like that. In the acute illness, you get the elevation of the which antibody? Yes, very good, IgM antibody, and that particular time you can also get a antigen of that particular virus. So antigen antibody can go together, it will reach as a peak, then it will come down. As the antigen, you can see here, is coming down, the antigen load, automatically the IgM antibody amount will come down. But now what will happen, since your body tissue is activated, you will get the IgG antibody which will remain into the serum, and this IgG antibody supposed to give you the protection against this antigenic infection in the future. So if we see the IgG antibody in the serum, we can conclude the patient has a chronic infection or chronic disease. I should not say infection, I should say chronic disease. This is what normally goes on with a hepatitis B virus, but it may not follow exactly the same rule, because patient with a IgG is supposed to be a patient who is undergoing a recovery, but this may not be true for the hepatitis infection. The next important point here is that the carrier stage. As I said, it is always with the hepatitis B virus, and once again the definition is the issue it comes. It means it is a patient who has a persistence of hepatitis B virus surface antigen in the serum for more than 6 months. Remember, when the patient has a hepatitis B virus infection, the surface antigen can go up in the serum, but normally it should come down to 0 level by 3 to 6 months. It means by 3 to 6 months you should not find any surface antigen in a patient who is suffering from or suffer from hepatitis B virus infection. Did you get it? No hepatitis B surface antigen after 6 months is normally present. But some cases what happen, this hepatitis B surface antigen, it will stay in the serum of the patient for more than 6 months and onward, maybe the lifelong presence. And if it is so, then we call it a patient who is a carrier for hepatitis B virus. You understand this one? Now, does it fulfill that rule of chronic disease? What is the definition of chronic disease? When the infection is present for more than 6 months, correct? And here what is happening? Hepatitis B surface antigen present for more than 6 months. So is it a chronic? Yes, it is a carrier as well as chronic. Now most of these patients are basically healthy. So the patient may not know that he or she is having infection. But since the patient is having this hepatitis B surface antigen, the patient can spread the infection to the other people. You see, this is a very dangerous patient. You do not know who is having this surface antigen wouldn't have it. That is why it is very dangerous stage. So is there any other way that we can diagnose the patient with a carrier? Yes, we can do the liver biopsy, which can be helpful. In addition to that, we can try that the elevation of the AST and ALT, and most of the time you get a mild elevation of the AST ALT. It won't be normal, but little bit elevation is present. So liver biopsy plus serology together can be helpful for the diagnosis of a carrier stage. But the patient who is a carrier, the patient also has a chance of a hepatitis D virus infection, and patient who is having a hepatitis B surface antigen for more than 6 months, of course it is qualifying for the chronic disease, and patient should have a very high level of IgG antibody in the serum. So let us see the carrier patient, how the patient should look like and what are the features of that. So here you see a patient here. Patient is looking very gloomy. It's not gloomy, it's smiling, so I make it gloomy. The patient is now very gloomy. You can see the patient is gloomy. And the patient knows that patient is ill. This is the body, these are the two hands, and these are the two legs. The patient usually may not know, but nowadays everybody knows everything. So there are a lot of surface antigen in the serum. S stands for surface antigen, and which is present for more than 6 months. Since this is also a disease which is present for more than 6 months, automatically it is a chronic disease. So patient should have a high level of IgG antibody in the serum to various antigens. Patient can have a mild elevation of the liver enzymes, that is AST and ALT. This elevation is something around 100 to 150. So this is the patient. Now this patient unfortunately has a capacity to spread the infection to the other people, other healthy person. So here you can draw a healthy person who is green in color, looking nice, very happy, and this patient can get this infection if the patient comes in contact to this person who is a carrier. So this is what is the danger of having a carrier patient, because he or she can spread the infection. Now this carrier patient, since the patient has a hepatitis B surface antigen, there is a probability that this patient can also get additional infection of the hepatitis D virus, because we know that the hepatitis D virus cannot survive with hepatitis B virus. So they all work together, and ultimately what the patient can have, what are the complication, what complication you can get if there is hepatitis D virus infection. Yes, the patient can get a fulminant hepatitis with liver failure. Fulminant hepatitis with a liver failure. So you see that you should tell the carrier patient that you are a carrier. Be very careful if you want to take a blood from something or someone, otherwise you can get the fulminant hepatitis. You are done. Shall I go to the next slide? So once again, this is the patient in front of you. Definitely looking at the patient, we cannot tell whether the patient has A virus, B virus, C virus, etc., etc. We can only tell the patient is having a severe liver damage. So this is a classical feature of a patient who has a damaged liver. So these are the few things about hepatitis A virus infection. We know that is